My name is Drew Klein. I am a board-certified sexologist, and I am the president and clinic director of FocusWave Clinic. Welcome to the Sexologist Office. The majority of patients who come to FocusWave Clinic are usually dealing with erectile dysfunction. It's about 2 out of every 3 of our men's sexual health patients are dealing with ED. Now, ED comes in 3 forms. There's a confluence of 3 major factors. Number 1, vasculogenic. Number 2, hormonal. And number 3, psychogenic. Now, obviously, the most important factor with regards to erectile dysfunction is your age. The older you are, the more likely you are to suffer from erectile dysfunction. 50% of men over the age of 50, 60% over 60, and so on. So age is the number 1 factor, of course. And usually guys who are in their 50s, about the average age of our patient is in the mid-50s. Guys who are in their 50s are usually suffering from some form of vasculogenic erectile dysfunction. What's interesting is that guys who deal with vasculogenic ED can also start to suffer from some form of psychogenic erectile dysfunction. It gets into your head. Sex starts in your brain. So you have a poor sexual experience, your anxiety levels go up. The next time you have sex, you're nervous. You don't want to have a bad performance again. Now you have a bad performance again. So you're on this negative feedback loop. It's going the wrong way. So at FocusWave, we try to get you in here, get you to do your Shockwave treatments, boost your nitric oxide levels, make a few lifestyle changes, and get you back into that positive feedback loop. Because if you can get that good sexual performance, that good sexual experience, get back again, and get you back onto that positive feedback loop, that can eliminate the psychogenic component from this problem. Hormone levels, really important to get checked, whether you're young or whether you're old. Get your blood work done. Find out what your free testosterone levels are. Find out what your prolactin and your cortisol levels are. Make sure they're not too high, because your stress hormone levels will cannibalize your testosterone levels, and your SHGB levels as well. It's really important to find out what your hormones are doing.